Hey doctors, I am Dr. Ahmed. I hope you all are fine. Let's discuss our lecture for. We will discuss about physiology. Let's break this down step by step to ensure we will understand the concept. As you can see from this diagram, the process is quite straightforward. Nociception and painful pathways. The journey of the pain from nerve to the brain. First step is transduction, transmission, then modulation, projection, and perception. Transduction basically nerve ending converts stimuli to the electric signals. Transmission signals travel to the spinal cord. Modulation spinal cord modified pain signals here, and projection signals ascending to the thalamus portion of the brain, and then perception brain intercept pain signals. There are different fiber involved. Let's discuss one by one. Alpha delta. This is the sharp and noxious receptors, like we can feel in pinprick, heat. C fibers, slow chronic pain, burning inflammation. Alpha beta, non-noxious, non-painful, like touch, profinimationer corpuscles involved in the alpha beta, and beta fibers. These are the autonomic functions involving blood pressure, gut motility. Pain types and characters. There are different types like neuropathic, pathological, physiological, visceral, and wind up. Neuropathic, as name suggests, damage to the neural tissue, usually chronic. Example like horse with chronic laminitis. Treatment gabapentin. There is one of the side effect of the gabapentin is stiffness, hypoglycemia, and seizures. Pathological pain, pain due to the any disease, highlighted response to the protect. Physiological pain, protective response to insult, also called the nociception pain, painful. Visceral pain, stretching, tension, or inflammation. Wind up, wind up, sanitization of the nociception. When one by one stimuli come, the total effect increases by time. Involve NAMDA receptors, treatment like ketamine, methadone, amantadine, dextromethorphan. How much an animal should eat? Basic energy requirement BER kilocalorie per day. Here is the formula 30 into body weight in kg and plus 70. If the animal is severely burned, you should multiply by 2 because it is severely dehydrated. Animal locomotion comparison plantigrade, digitigrade, unguligrade. Planti walks on the entire foot like humans, bears, rodents. Digit, like name suggests, digitigrade, bark on the two's digit. Involves dogs, cats, and birds. Unguligrades, barks on the hoofs like ruminants, horses, deer, and the goat, sheep. Abnormal plantigrade posture is seen in patients with injury to the Achilles, injury to the gastrocnemius muscles, weakness from the nutritional myopathy due basically deficiency of the selenium, the ruminant, and in cat due to the diabetic neuropathy. There are different derms. Ectoderm involve nervous system, tooth enamel, epidermis, linings, sweat gland, posterior vagina, adrenal gland, the Bcse pouch, and mesoderm involved skeletal muscles involving the structure like bones, cartilage, circulatory system, urinary systems, and connective tissue. And lymphoid tissue, gonads, genital ducts, anterior vagina, adrenal cortex, and body cavities. And ectoderm, GI tract, epithelium, respiratory tract, liver, pancreas, pharynx, larynx, urinary bladder, urethra, and endocrine gland. There are terms aborally. Aborally means moving away from the mouth. Staphylococcus aureus and some corynebacteriums are normal flora of the skin, and the mucous membrane. Enterobacter species are the normal flora of the gastrointestinal tract. These are important. There are different functions. Let's discuss by one of the cellular component like nucleus. The cell control center transcribing DNA, nucleolus transcribes RNA essential for the protein synthesis. Endoplasmic reticulum synthesize protein and the lipids. Golgi apparatus process and package protein and lipid. Sarcoplasmic reticulum regulate calcium for the muscle contraction. Mitochondria generate energy in the form of the ATP. Fibrin, the end product of the clotting cascade. Plasmin break down fibrin to prevent blood clot. Kupffer cell associated with the liver function. Histiocyte associated with the connective tissue. These are important. Osteoclast associated with the bone remodeling, bone forming cell. Fimbria aids in the bacterial attachment, and osteocytes found in the mature bone derive from the osteoblast. Osteoblasts are the bone destroying cells, and osteoclasts are bone forming cells. Now discussed about the cardiology. Uh, this is the chambers of the heart, and let's discuss about the circulation of the blood uh, inside the heart and the outside the heart. This is the superior vena cava and inferior vena cava inlet. This is the right atrium, and this is the right ventricle. Blood comes from the body into the right atrium, then through tricuspid valves, three flap valves. It goes to the right ventricle, and from right ventricle it goes to the pulmonary artery. This is the deoxygenated blood. From pulmonary artery it goes to the lungs for the oxygenation. After oxygenation, blood comes through pulmonary veins into the left atrium. Then from left atrium to the left ventricle through the mitral valve, it is the two flap valve. It goes into the left ventricle. Then from left ventricle, it goes to the aorta through the aortic valve and goes to the body and give oxygen to the different part of the body. Vertebrate have a multiple chamber heart. and a close circulation with the capillaries. Their heart has two chambers in the fishes, three chambers, two aorta, and one ventricle in the amphibians and the reptiles, and four chambers in the birds and the mammals. We will discuss echocardiogram. The P wave indicate arterial depolarization. Depolarization means contraction. QRS complex consists of a Q wave, R wave, and S wave, and represent ventricular depolarization. T waves comes after the QRS complex and indicate ventriculars involvement. Heart sounds and the cardiac cycle. AV S1 sound is AV valve closure. Mitral and the tricuspid valves close, produce lub sound. S2 semilunar valve, aortic and pulmonic valve producing dub sound. S3 ventricular filling, mostly in the rush in the horses. Rapid ventricular filling create a third heart sound. And arterial contraction horses. Arterial contraction generate a fourth heart sound. Ventricular contraction systole is the phenomenon between the S1 and S2. One uh, when the AV walls going to open and aortic and pulmonic walls are going to close. A diastolic is ventricular filling. It is a phenomena S2 to S1. It is a reverse phenomena. So this is the arterioventricular walls between the left and right chambers of the heart. This is the semilunar walls between the pulmonary vein, pulmonary artery, and the left and the right atrium, and left atrium and between aorta there is a valve called semilunar valves. So when the mitral and tricuspid valves closes, it produces the lub, and when semilunar valves close, it produces a lub sound. This is the heart valve of the inferior vena cava, tendon of the Darrow coronary sinuses, septal leaflet of the tricuspid valve, atrioventricular node. This is the nervous conductive system of the heart. This is the SA node on the right atrium, internodal tract, anterior, middle, and posterior. This is the anteroventricular node. This is the bundle of the His. From SA node, then bundle of the His. Um the bundle of His goes to the ventricles, and it spreads on the body of the ventricles. This is the right bundle of His. This is the left bundle of His, and this is the Purkinje fibers. Purkinje fiber only present in the ventricles. So this is the pathway SA node, AV node, bundle of His, Purkinje fiber, and ventricles. Key location SA node is right atrium, pacemaker, AV node, bundle of His, ventricular septums, Purkinje fibers, ventricles. Horses, Purkinje fibers embedded in the myocardium. So it simultaneously give contraction to the heart of the muscles. ECG basic and lead placement. There are different leads that would be helpful uh, to check the echocardiogram. So in dogs and cat we use lead 2 mostly, and placement is very important. White lead on the right arm, black left arm, and red left leg. So this is the mnemonic: white on the right, smoke over the fire. White on the right mean white on the right side, and smoke mean black, and over the fire red. Black on the red. So though these both are on the left side. So in a horses and cattle, uh, base apex, right arm base of the neck, left arm fifth intercostal space, and left leg stifle. ECG waves and abnormalities. P waves arterial depolarization biphasic. T waves ventricular repolarization. Ventriculars are going relax. AB wave. A wave is arterial repolarization. Only visible in the horses. This is important. Abnormalities. ST segment depression elevation indicate myocardial hypoxia. If there is a depression and the elevation in the ST segment, this shows myocardial hypoxia. Electrical alternance, swimming heart, pericardial infusion indication. So heart rate in different species: dog 70 to 120, cat 120 140, horses 28 to 40. In dogs, sinus arrhythmia is normal, and sinus arrhythmia is basically the that controls the heart rate with the inspiration and the expiration. In cat, sinus arrhythmia is abnormal. In horses, S3, S4 are normal and can be audible. Ductus murmur in the infoles. Blood pressure and receptors, mean arterial pressures, critical for the perfusions monitoring the anesthesia. Diastolic pressure, coronary perfusion occur here. Receptors are alpha 1. Alpha 1 involves the contraction of the smooth muscles. These are the cause vasoconstrictions. Beta 1 increases the heart rate, contractibility, and vasodilation. Calcium channel blockers, antiarrhythmic, but are the negative inotropes. Sinus arrhythmia is the variation of the normal sinus rhythm that characteristically present with an irregular rate in which the change in the RR interval is greater than 0.12 second. In dogs, sinus arrhythmia can also occur without being in signs with the respirations. So can be occur without any synchronization with the respiration, and is instead association with the variation in the intensity of the wiggle tone. When wiggle tone increases, the digestive system, the movement of the digestive system uh, increases, and normal function of the body increases. So whenever wiggle tone increases, the sinus arrhythmia and the dog's pills also increases. Clinical pearls like involve sinus six sinus syndrome, alternating bradycardia and tachycardia, chemodectomas, tumors of the carotid and aortic bodies. This is important. Chemoreceptors. Second degree AB block common in the horses. Uh, High wiggle tone. Due to the high wiggle tone, second degree AB block is common in the horses. Horses have the high wiggle tone, so When there is high wiggle tone, AB block disappear with exercise. Horse, high wiggle tone, psychological AB block. So when horse is not at rest, uh, there is no AV block. But with exercise, there is increase in the high wiggle tone that causes the AV, second degree AV block. Dogs, sinus arrhythmia is normal. Heart rate increases with the inspiration and decreases with the expiration. Cat, sinus arrhythmia is abnormal and indication of the any disease or pathological condition. Vagus nerve, vagal tone increases. Acetylcholine act on the SN node and then decreases the heart rate. So in horses, exercise override the wiggle tone. Now discussed about the GIT. This is the first part: buccal cavity and esophagus, lips, tongue, teeth have three glands: salivary gland, parotid gland, mandibular gland, sublingual gland, hard palate, soft palate, oropharynx. Horses and rabbit can't vomit in because strong cardia sphincter. Cardia sphincter is present between the esophagus and the stomach. There are different layers of the stomach. This is the mucosa, then submucosa, then muscle layer involves two layers, longitudinal and horizontal, and then outer layer is serosa. This is esophagus. Upper part of the stomach is fundus, then body is rogue, then pylorus, and ending part, and then duodenum. There are different cells involving the digestion in the stomach: parietal, secrete at Cl, acidified stomach, and chief cells secrete pepsinogen, chymosin, protein digestion, and mucus cell produce mucus and protect lining of the stomach. Stomach anatomy and secretion: 5 stomach region: cardia, entrance, fundus, distensible gastric gland, body. There are glands present in the fundus. Pyloric arterium, G cell produce gastrin, and pylorus, sphincter to the duodenum. Component of the ruminant digestive system: there are four compartment stomach or digestive system in the ruminants. First is rumen, have papillae, involves fermentations, then reticulum, honeycomb, hardware disease, and risk. Hardware disease basically uh, honeycombs involved in the capturing of the stones, metals, so it protect the animal from further injury. Omesum involve the lamini, water absorption, and abomasum is a true stomach. This is glandular, same like the human horses. Calves, renin clot milks. Calves have renin, so it clot milk, so slower digestion. There are motility and regulation. Parasympathetic increases motility and sympathetic decreases motility. Parasympathetic increases the motility of the fundus uh, and atrium contraction. Sorry, it decreases the fundus contraction. Sympathetic, fight or flight, slow digestion. Peristyle- Peristalsis, breast segmentation. This is important. Segmentation is simply the mixing, and peristalsis involving the propulsion, involving the movement of the GIT tract. So parasympathetic involves the push foot throw, increase the motility. This is the nervous system. Have two part: peripheral nervous system, central nervous system, the body control unit. Peripheral nervous system, body link to the outside world. CNS have spinal cord, brain, and brain stem, and PNS involved with the autonomic nervous system and somatic nervous system. Autonomic nervous system further involve the sympathetic nervous system and parasympathetic nervous system. Sympathetic fight or flight, and parasympathetic involving the normal activity of the body. This is the digestive system of the bird: crop, then proventriculus, then ventriculus, then bursa or fabricus. Bursa or fabricus involving the hematopoiesis and B cell maturation site. Ventriculus, muscular stomach with grit for grinding. Proventriculus, glandular stomach for digestion, and crop, temporary feed storage in the esophagus. This is a simple flowchart of the digestion process in the ruminant. Small intestine involve duodenum, jejunum, and ileum. Then in duodenum, there is the crypt of Lambertine, then goblet cell, peristalsis, segmental contraction, absorption of the nutrient. There are starch digestion, protein digestion, and fat digestion. Fat digestion involving the micelle formation and then transport through the child, chylomicron, chylomicron. This is the structure of the intestinal villi, lymph vessels, nerve, vein, and artery. These are the circulatory and nervous system. And on that, there is a cells called enterocyte, and between enterocyte there are goblet. On enterocyte there is a microvilli for absorption. The green line is lacteal. Lacteal is a part of the lymphatic system. Now discuss the reproductive system. There are different hormones and their function is very important. So GnRH, their function is the start estrous cycle. FSH stimulate sperm cell division. LH stimulate T4 prostaglandin. Terminate corpus luteum. Corpus luteum involved in the maintenance of the pregnancy. P4 support healthy pregnancy. Estrogen dilate and relax cervix, and oxytocin promote milk letdown. So sperm evaluation motility. Whenever we have to check the sperm quality, we have to access first uh, their motility because it degrade with the time, and sperm should be stored at 37 centigrade. If there would be a cold shock cause the permanent damage. GnRH starts spermatogenesis, formation of the sperm, initiate estrous cycle. FSH causes the Sertoli cell Sertoli cell to produce sperm and involve the follicle for maturation, and LH, leading cells, involving the production of the T4 and also the ovulation graphene follicles. Prostaglandin F2 alpha, involving the luteolysis. Luteolysis is the basically the destruction of the Cl and production of the progesterone. Sport pregnancy. Sorry, prostaglandin involves the luteolysis, and P4 involves to support the pregnancy and increases the pyometra risk. Oxytocin involved in the milk letdown and the contraction of the uterus. Pyometra P4 endometrial hyperplasia with addition of the WBC suppression causes, so there may be infection. So we should remove P4, and prostaglandin F2 drugs involves the fluprostenol butylase. Butylase induce stress and abortions. Bird luteinizing hormones trigger evolutions because there is no Cl in the chicken. There are different placenta. First one is the corti cotyledonary in ruminant, and second is diffuse. You can see present in the pigs, and zonary on the center part present in the carnivores, and discoid on two side present in the ruminants. So this is the fetal side, this is the maternal side. Number one is epitheliochorial. By structure, their name is the epitheliochorial, present in the pigs and the horses. In B, there is a syndesmochorial, present in the ruminants. And endotheliocorial carnivores, and hemochorials is humans, hemo, blood, chorial. So hemoendothelial, present in the rabbit and rat rodents. These are important, you should remember the name, which placenta, which type is present in which species. So cotyledonary, cow goat placentomes involves the cotyledon and the caruncle. Cotyledons toward the fetal side and caruncle toward the maternal sides. Zonary, dog and cat band like placenta. Diffuse, pigs and horses. Uniform attachment. Unduce ovulators, cat, ferrets, and llamas. And fertilization occur in the oviduct fallopian tube. Now discuss different estrous cycles in different species. Dog. Estrogen increases vaginal epithelium cell turnover, cause cornification, anestrus and proestrus. There is a cell pink purple, and estrus and diestrus cells blue purple. In estrus, there is a more superficial cell. In proestrus, there is more RBCs and as well as some superficial cell. Parturition 58 to 72 days after breeding. In Basenji breed, one estrous cycle is equal to 1 year. Pregnancy detection, abdominal palpation at 21 days and radiograph more than 45 days. LH surge peak at the behavior estrus. So after ovulation, after 2 days of ovulation, there is a LH surge. Parturition and transient temp drop into the beach. In feline, Parturition is 64-69. From breeding, if there is unknown estrus, or if we know the ovulation date, then after the 63 days. And pregnancy detection at 21 days through palpation and ultrasound, heartbeat 28 days, and radiograph more than 40 days. Memory development in final 2 weeks. Estrus reoccur every 2 to 3 weeks. Lemma camelid. External recumbency shows the stress behavior. Their neonatal is called the Syria. This is important. So there is maybe one or two question from this stress cycle. Equine. Signs are the terrorizing vulvar winking, urinations, vulvar swelling, hind leg abduction, moving away legs, Bcse teats, falling in 60 to 48 hours. Anestrus in winter needs long days to ovulate. Embryo, motile for 16 days, attaches to the uterine horn. Pregnancy detection, day 11, early, and heartbeat at 25 days. Endometrial curves produce ECG from 40 to 120 days gestation. Bovine, Estes behavior, 18 hours standing to be mounted, clear mucus discharge. Soft corpus luteum shows the distress. Pregnancy detection, membrane sleep at 30 to 35 days, placentomes at 70 to 75 days, and fremitus 90 to 120 days. Premartins. What is premartin? If there is twins in the ruminants, sterile XX and XY is chimera, show vagina no cervix. Reproductive target calving intervals 13-month, conception rate more than 40, and the cervix conception is less than 2.5. Expected stress stay. Non-pregnant cow divided by 18 to 21. This is a cycle. So this is how we calculate the ex expected stress stay. Number of the non-pregnant cow divided by the 18 to 21, such as 100 cows divided by cow and divided by 21 or 80 is equal to 4 to 6 in each test daily. So pre-Martin, this is important. Basically is a infertile cow with masculinized behavior and non-functional ovaries, short vagina, no cervix. Phenotypically it appears as a female, but have different characters of the male as well as the female. Sheep fine wool breed shorter anestrus or ovulation rate, polygenic trait. General red, dark green vagina discharge, placental detachment. Lochia, important. Normal postpartum discharge, blood mucus, and placental tissue. Hypo means non-pathological rubbery masses in the allontonic fluid. Wait a second. These are different species with the age, cycle length, estrus, time of breeding, first estrus after pasteurization. So their duration is very important. Their cycle type and length is very important, and their estrus range is important. So straightforward question from any of these columns. So let's discuss one by one. Cattle puberty at 10 to 12 months, usually first bred at approximately 14 to 15 month. Cycle length is 21, ranges from 18 to 24. Is polyestrous all the year. Duration is 18 hours. Heat duration and best time insemination from the mid estrus until 6 hours after end of the estrus. First estrus after pasteurization 20 to 60 days. Ovulation occur uh, 10 to 12 hours after end of estrus. Sheep 6 to 9 months. Polyestrous 17 days. Cycle length. Heat is 24 to 36 hours. 18 to 20 hours after the onset of the estrus. And ovulation occur near end of the estrus. Court is also a seasonally polyesters and length of the cycle is 21 days and pregnancy pasteurization date is 5 to 7 months. Duration of estrus is 24 to 48 hours. Daily during estrus, best time to breed. Pig 6 to 7 month, horses 12 to 24 month, alpaca 12 to 18 month, dog 6 to 24 month early in the summer breed and later in the larger breed. Cat 4 to 12 month. So pig is the polystrus, horses is the polystrus, alpaca is the polystrus, dog and dog is only the monoestrus all the year. And cat is polystrus. So these are the table you can go through. One important slide is copulatory plug found after mating in the vagina of the guinea pig. Chinchillas and small rodent carnivores such as the dog and cat have os penis baculum, which is a penile bone. Sperm capacitation. It is a membrane change that allows fertilization. It happens after the sperm is deposited in the female reproductive tract. Testes is responsible for the development of the sperm head and the collection of the tail and midpiece. In testicular tissue, cells such as the macrophilic, microcephalic, and double sperm head. These are different abnormality of the sperm. Are the signs of the meiotic failure that occur in the testes. Epididymis, where the later maturation of the head, tail, and the midpiece occur, and where spermatozoon gains motility. These are all important, different part and with different functions. In canine, there is a musculovascular penis. Spermatozoa more than 80% morphologically normal and 7 to 80% progressively motile after 5 to 8 weeks. Only have the prostate gland. In feline, there is ampulla, prostate gland, and bulbourethral gland. Musculovascular penis. In bull, goat, and swine, there is a fibroelastic penis with sigmoid flexure, vesicular gland, prostate ampulla, and bulbourethral gland. Fibroelastic penis with a sigmoid flexure, spermatogenic cells of graduated sheep, vascular gland. They have four glands: vascular gland, prostate gland, ampulla, and bulbourethral gland. So one of the question from one of these species about the glands. Give me a second. We will discuss our remaining physiology in our next lecture. And give me a second. Let's discuss this again. In sheep, there is a fibroelastic penis with a segment flexure. So, whether is a castrated male sheep. Sheep have vascular gland, prostate gland, ampulla, bulbourethral gland. Goat. Goat have vascular gland, prostate gland, ampulla, and bulbourethral gland. Equine. Equine have vascular gland, prostate gland, ampulla, and bulbourethral gland. So these three species have four glands. Bovine, fibroelastic penis with the sigmoid flexure, S-shaped flexure in the penis. This is important. Swine, their penis type is fibroelastic with sigmoid flexure. Paro is a castrated male. Pig. Boars are intact male. Have a perpetual diverticulum that produces an odor attractive to the source. Boars have vesiculars, prostate, and bulbourethral gland. They don't have ampulla. Feline have only two gland, prostate and bulbourethral gland, and musculo musculocavinosus penis same in canine and the feline. So this is important. Dogs have only one gland, prostate gland. I hope this lecture would be useful for you. So in our next lecture, we will explore uh, a different system, and we will start our surgery or anesthesia portion. Thank you for today.